So thank you for joining in today to discuss the assignment discussion session for person-centered approach. That's the unit we are looking at covering. And in this unit, we have completed so far the 3 learning outcomes which are required to be studied. So I'll briefly bring them up on your screen so that we can have a quick look at in terms of what we've covered so far on this particular unit. Now, when we look at person-centered approach, what we have seen over the last couple of weeks is that we've covered, the importance of person-centered approach. We've covered how a person-centered approach was developed. We've looked at some of the challenges which were faced, and obviously what are associated with the, implementation of person-centered approach when we look at providing integrated care or, using this as an approach to provide care for the patients who are receiving treatment or any sort of, let's say, health and social care requirements within the National Health Service. We also looked at understanding, how the key legislation and laws have to be looked at for the purposes of implementation when, a particular care setup like a care home, a surgery, hospital, any department have to implement the person-centered approach. And we looked at, understanding the key legislations which were around, the Healthcare Act, the Care Act of 2014, the Mental Health Capacity Act, the Equality and Diversity Act, Data Protection Act, and some of the other legislations which were important for us to understand why this approach has now become the central pillar of, delivering care within the National Health Service. We also looked at how do we look at collating, information, advice, and guidance when we look at essentially, providing person-centered care. And we look at this approach, person-centered approach or PCA, and we looked at 3 different concepts, which is equality, diversity, and discrimination, and why they need to be, taken into account so that we, at any given point in time as a practitioner, when you're looking at delivering care, you're not looking at this, you're ensuring that there is equality in terms of care being provided because NHS and obviously some of these setups are diverse in nature, so we include and celebrate diversity. And last but not the least, we eliminate any sort of discrimination which can happen primarily or lead to some sort of a discrimination due to abuse, neglect, or harm can be inflicted. And in those cases, look at ensuring that we are aware of the discrimination policy. And these are key concepts that we covered in Learning Outcome 2. In Learning Outcome 3, we essentially focused on understanding how do we look at marrying or understanding the person-centered approach, and how do you do your own analysis in terms of your skills to see how you fare in terms of having these qualities, personal qualities, which will allow you to deliver care using person-centered approach as a core philosophy. We also looked at, what are the various challenges when we look at implementing person-centered care or person-centered approach, and what are the ethical issues which are encountered as practitioners when you're delivering this care and providing this care to people who are receiving treatment in any sort of a care or health and social care setup. Now, in today's assignment, we are looking at covering, and then when we look at the approach, which is primarily in terms of understanding the own skills, there is a skills audit that we have done, and that audit primarily is an audit of your own skills, which will be looking at this particular format. And this is something which I've shared with you guys on WhatsApp. And this is a format which is slightly adapted from the task 1 of Learning Outcome 1, wherein in the first task, we looked at defining what are person-centered values, the 8 person-centered values. And then in the same, template, what we've done is we've added skills, and what we need to look at is in that template, when we've identified the person-centered values, what we want to be able to do is attribute what skills do we have meeting those person-centered values is the main task that we have to do in the case of when we look at doing task 4. And we will be using this particular template which is given in the assignment brief, and that would help us do a bit of an audit in terms of our own review of person-centered skills and then putting in activities. If we do feel that we don't have these skills or we have these skills which are missing, then we can put these activities in place so that we are able to essentially improve on those areas of weakness, and then provide care when you're working within the National Health Service or any sort of a care setup, using the person-centered approach to patients. Now, one last bit. What we are going to do is essentially look at discussing this particular assignment brief, which I've converted into a PowerPoint presentation. And what I would want to do is basically show you and discuss with you some of the key bits in terms of how you would look at going about compiling the assignment, and obviously looking at the approach of completing a document which is based on a case scenario which has been given in the assignment brief. So just before I switch over to the presentation, what I want to do is basically quickly run through the case scenario, and these case scenarios typically are, if I just 1 second. Right, so I've got a few learners which were obviously struggling to get in, and I've got them in now. That's great, thank you. So, hello.
Hi. Okay, I can hear you now. Yeah.
So basically, there is a bit of a scenario in this assignment brief which we need to be able to refer to and look at from a point of view of doing the assignment. So this particular scenario talks about a referral has been made in respect of Mabel. Now, Mabel is a 92-year-old widow who lives on her own. She has diabetes. There is some conditions and background given about the patient. She has diabetes and obviously poor mobility problems. She suffers with arthritis. And she also has an esophageal dysphagia, which means she has a difficulty swallowing her food. And she has been recently admitted to hospital because of her weight loss. Now, a PEG feed is now being used. That means a feed or an NG tube has been inserted into her mouth, and through which she is now being fed. Now, she wants to live on her own in her own home, and she's anxious that this treatment obviously is delaying her, and obviously it puts her away from her daughters, who she sometimes loved to care, live with, and obviously cares about. Now, here, a multidisciplinary team meeting has happened within the care home of the setup. And what the meeting has discussed is that they need, when I say multidisciplinary meeting, what I mean by that, I think in the scenario, what they mean by that is that a number of practitioners who are providing care to Mabel have been called into the meeting, and they have discussed. So these could be practitioners like nurse, healthcare assistant, social workers, who will go in and provide some sort of support to Mabel when she is discharged from the hospital, doctors. And these people essentially would be, providing care to Mabel to help her, get over her condition of esophageal dysphagia, which means difficulty in swallowing. And then once she is better, she will be released from the hospital, and local authorities, social workers, triage of nurses and healthcare assistants will be able to provide support to her at her home while she is able to get back on her feet and resume her normal daily functions. Now, this is a bit of a background which has been given for us to look into doing the assignment task. And here, the the assignment is divided into 4 tasks. The first task talks about giving you a bit of a background, again, a scenario saying your line manager knows that there is a problem which is uncommon in the local area. She has asked you to produce an information sheet which can be used by some of the other colleagues who would provide support to Mabel. And this sheet would cover these particular assessment criteria. So they include things like task 1.1, assessment criteria 1.1, which is looking at importance of person-centered values, how they were developed, and then what are the challenges. And for those of you who are looking at achieving, a merit or distinction grade, Then you are looking at doing some of the extension activities. So there's a 1D1, which is the first distinction criteria in the assignment, and it talks about recommend ways to. You've discussed challenges here. So what we need to do is put more recommendations in. First is we have identified what are the challenges. Now what we need to be able to do is give solutions, or basically provide recommendations of how these challenges could be overcome. And then we'll go on to task 2, task 3, and then followed by that into task 4. So let me look at, rather than going through the assignment brief as a Word document, let me switch you over. And what we are going to do is discuss it out with the use of, by using a PowerPoint presentation. So I hope you're able to all see the PowerPoint presentation, which I've opened up now. And this PowerPoint presentation essentially would, be the assignment brief, but it'll allow us a bit more description and, flexibility to be able to discuss what is required to be done in the, assignment brief. So what we are going to do is use this, a presentation slide to discuss how do we go about completing the evidence for this particular assignment. So let me start. Now, a couple of things before I get into the assignment. What I want to make sure is that I want to, give you a bit of an idea in terms of how you would go about essentially, let's say, starting the assignment. Now, when you look at the assignment brief, what I would suggest in some cases is that when we look at doing the assignment, we want to make sure that, we are, reading the, let's say, the tasks carefully. And when we are reading the tasks carefully, what we know is, and we put focus on in terms of what these tasks are asking us to do in terms of the assignment. So when you compile the evidence, we have to be sharp and concise in terms of what is required to be, actually done in the assignment. So in this case, what we are looking at is a couple of things. First is looking at, we need to be able to focus on some of the tasks at hand. So what I would do is, basically, when I say task at hand, we need to be able to read, the assignment brief carefully. And once we have read the assignment brief, we need to identify very clearly that there is a scenario which is given, which would be referred to time and again when you're compiling the evidence for the, let's say, the tasks that you're doing in the assignment brief. Last but not the least, what we also want to do is we want to focus on some of the command verbs. Now, there are different types of words which are given, which will define what the task is asking you to do. And these words that you see, would be basically also giving you a bit of an indication in terms of how much to write, how much is too much to write, and how much is too less or too little. And you would need to make sure that you're doing justification to the command verb or the word which is asking you to say that this is the bit that you need to, look at compiling or providing evidence for, and you would require to write this many number of words to be able to justify the evidence, and that would allow you to convincingly achieve, the, task. So when we look at this as an example, there are some bits and pieces of it which I would suggest that you need to know, that when we look at command verbs, there are different types of command verbs, and these command verbs, basically, allow you to understand that there is a bit that you need to look at, when you look at, essentially, compiling the evidence. So they are categorized in 3 different contexts. Because command verbs and this particular unit is graded, pass, merit, and distinction, what you're going to be looking at is that, generally speaking, these command verbs would increase in complexity as we go into the assignment at any given point in time. So explain, define, describe tend to be pass command verbs. Assess, examine, clarify, analyze tend to be merit command verbs. Compare, contrast, critically evaluate or evaluate tend to be distinction command verbs. Now, so the other bits that you have to just be aware in your case is that when we look at referencing, where you take the material from, you have to be very clear that the referencing has to be done, using Harvard referencing method. And when we look at referencing to be done, this bit tends to be, the author date style referencing system. So if you're going to be looking at, essentially reading stuff from places and then putting it in your own words, that will be paraphrasing, but you'll need to give the source towards the end as a bibliography towards the end of your document, at the end of your assignment. And that would allow you to, essentially ensure that the work that you provided has been, you have provided due credit to the authors, publishers, scientists, or, people who have created that text by referencing it appropriately. Now, there are no word limits, but I would generally suggest anything going about over 4,500, 5,000 words would increase your chances of plagiarism and obviously increase similarity. So it is always good to be succinct in terms of understanding how much to write. And that is where the bit in terms of command verbs actually become important. So if you know the definition of the word and how much to write, your work is also going to be succinct, but yet looking at meeting the criteria, for the purposes of, achieving the task. Now, last but not the least, what I would suggest is when you look at the assignments, most of the assignments generally tend to have what is called theory, application, and example. So in some cases, when you look at, the concept of, I would say, bits being applied from a point of view of explanation and reference to theoretical models, like the person-centered approach, the person-centered values, the 6 C's of communication. These are bits which are going to be relevant when we talk, or legislation, in this case, law and legislations, which are to be mentioned in some of the tasks. They would generally constitute what is called theory. When we show the application of these legislation, for example, how equality and diversity policies applied, or how Data Protection Act is applied in an organization, or how do you ensure that you're aware of person-centered values, then in those cases, what you're looking at doing is showing and talking more than how these values, can be applied in a particular situation. And that is where it shows application of the, content. Now, a simple example of this would be when we look at task 4, in the assignment later that we look at, what you're going to see in that task 4 is it says review your person-centered skills. So we know that we've studied person-centered values, the 8 different values that we've studied in the first learning outcome. What we have to do then is to relate those person-centered values to our person-centered skills, our personal skills, traits that help us to become more, aligned to be able to use person-centered approach and then deliver care to the patients. So in those cases, what you're looking at doing is essentially looking at talking about your own skills and that being related to the values that we have studied. And that shows the application of how you understand person-centered, approach. And last but not the least, when we look at an example here, Mabel, which has been given, Mabel is a 92-year-old widow who has a problem with the, swallowing, esophageal diaphysis. Now, in this case, this particular, situation that has been given for you to stitch examples in places where you need to show and talk about the application of a particular concept or theory. And this is where you need to keep in mind, sometimes in some tasks, you will see theory, then you will see application, and then you will see example of what is currently being done from a point of view of, essentially compiling as evidence in the assignment. Now, just to be sure, since there are 4 tasks in the assignment, there are tasks 1, 3, and 4, which will require you to produce a Word document, and task 2 is essentially a PowerPoint presentation. So just keep this in mind, that when you look at compiling the assignment for this particular unit, what you're going to be seeing is that task 1, 3, and 4 of the assignment brief would essentially require you to produce a Word document, and task 2 will be a PowerPoint presentation. So in effect, when you submit the assignment into us, what you would need to do at some stage would be that at some stage, what you're looking at doing is you are primarily looking at, compiling 2 different types of documents. One of the document is going to be, looking at producing a Word document. And the second type of document that you're going to be looking at is a PowerPoint presentation. So these are bits that you need to be aware of. And when you look at, obviously providing, the final version of the document to us, please ensure that when the assignment is submitted, we know very clearly when the assignment is submitted, that assignment will come across with in the email with 2 attachments, a PowerPoint presentation and a Word document. Now, referring back quickly to the scenario, which I've copied from the assignment brief, there is nothing new here. I've copied it from the assignment brief, wherein it is going to be used as an example that you're going to then quote wherever required to show the application and the implementation of that concept that you are covering in the assignment. Now, Task 1 talks about explaining the importance of person-centered values. This is 1.1 criteria. So here, what we are looking at doing is covering the 8 person-centered values that we've discussed in our first, session, and they would include things like independence, dignity, respect. So if you recall some of them, those are the ones that you need to cover here. Now, for this, what I've done primarily was, ensure that you are going to be looking at you're looking at essentially, writing, because it says explain. So there is a Word document table that I had sent across in Moodle and obviously on WhatsApp as well. And that table essentially allows you to, fill those details up, and that would cover and basically help you meet the first task. The second one talks about how the person-centered values were developed. Now, for most of you, if you recall during our discussions, what we had done was I shared a handout which was from Health Foundation, and that handout from Health Foundation, is a PDF document which primarily gives you a bit of a background in terms of the person-centered approach and how this approach was developed by the American psychologist Carl Rogers, and then finally how it was adapted into the National Health Service after the Lord DiHSC's report in 2008. So basically, this background has to be put in as a bit of a summary at your end in the task 1.2. Now, in task 1.3, we need to discuss challenges. And when we talk about some of these challenges that we've discussed during, the discussion of learning outcome 1, there were challenges that we discussed, challenges which were related to cultural challenges, communication challenges, barriers which could come up when you look at, communication and culture. Sometimes some of these challenges could be technology driven. So you have to explain a couple of challenges because it says with an S. It can't just be meaning that I write about just a cultural challenge, that if I don't speak the language and, if sometimes an interpreter is required, or if the person is shy and it needs to be accompanied by an elderly person or a person who they feel comfortable with when discussing their problem with the doctor or a nurse, then in those cases, communication interpreter, for example, or cultural barriers could be challenges which practitioners face, and those are what you need to be mentioning specifically here when we talk about the person-centered approach. Now, in the extension activities, what we are looking at doing is basically talking about creating what is called an information sheet, and this information sheet essentially talks about recommendations that we can make and how to overcome these challenges. Now, this is a small table that I put up here on the PowerPoint slide. And this small table on the PowerPoint slide essentially tells you that if we look at the current practice and we look at the person-centered care approach, we see there are differences between the two approaches and how they help us in overcoming challenges. So you could do a table like this, which could basically show challenges here, which you have covered in task 1.3. And then you can also write or talk about what are the challenges and how these challenges can be overcome. So if I say, in my discussion that we need to look at talking about what are the challenges in person-centered approach and how we can overcome these challenges, we would be looking at, talking about challenges which could be training and development challenges. It could be challenges related to communication. It could be challenges related to people not having to understand what are person-centered values. So sometimes they are not able to respect or show empathy to their patients because they do not understand or they are not sensitive to the aspect of certain person-centered values like empathy and respect, and they could come across as challenges. And last but not the least, sometimes you see, that when we look at challenges, they could be challenges that you would face primarily because you are not able to communicate, or the communication or the information communication part of it has not been done properly. And in those cases, you would generally see that these challenges could be, creating problems for you to be able to deliver care to the patients. So in some cases, when you look at recommendations, what we have to do is we have to look at now recommendations to how to overcome these challenges. Now, these recommendations would be training and development. So that means all staff needs to be trained to understand what are person-centered values. They need to understand how to respect and show empathy towards patients or people who are coming in to receive care. We should also be looking at addressing barriers in communication, which is basically understanding any sort of constraints, which could be because of resources, time limitations, or sometimes when we say a practical example of this is if you are working within a cardiac unit, and if patients are being sent into the CCTU unit after a surgery, then normally what you will see is each patient has one set of practitioners, maybe specialist nurses and healthcare assistants taking care of each patient because they've had a surgery and they're still under a general anesthesia. So in those cases, what you will generally see is the team of a team, which is a team comprising of a clinical nurse, and a healthcare assistant, including doctors, take care of that patient till the condition stabilizes. Now, in order for them to be able to do so, they would need to overcome certain barriers. Now, one, the patient is under general anesthesia, cannot speak, but in those cases, how would you overcome those barriers? One, they have received adequate training to be able to take care of patients when they are discharged from a major surgery and they are still under the effects of general anesthesia. They would also be trained and educated on and provided development and training on in terms of how to deal with family members and update the family members, and also look at seeking information from them till the patient gets consciousness or regains consciousness. They could be one of the other challenges that they have to overcome is they have to look at providing continuity of care. That means they will need to be looking at maintaining consistent communication and coordination with some of the other members in their team, like doctors and nurses, and also other healthcare providers who would then be making them aware of the situation of the patient and whether the patient's condition is getting better and what needs to be implemented or given as medication to the patient so that the patient is able to recover and successfully come out of the effects of any general anesthesia which has been administered after a surgery. So these challenges would be required that you would need to mention and then make recommendations using like an information sheet or like a table given here, and they would allow you to essentially cover this particular point. Any questions on this so far? Now, if I look at going back to the slide, and if I am in your case and you struggle to come up with an example, then I would suggest that you go back to the scenario of Mabel. Use this as an example to show what challenges will the team of practitioners face. For example, she's a widow, she's 92-year-old, so she's an elderly woman. One of the challenges will be to look at communication, and obviously the way she processes information is going to be a challenge. So communication will be the key, but speaking to her and making sure that she understands what you're speaking is going to be a challenge. The second is she's actually suffering with what is called a condition called esophageal dysphagia. That means esophageal dysphagia is a condition wherein the person experiences difficulty in swallowing. And when we look at difficulty in swallowing, there are lots of reasons of why the patient is basically then given therapy. And that is why she's been admitted in the hospital. So one is sometimes patients are indifferent to understanding why is that condition has developed and why she has been brought to hospital to be able to get treated for this. Now, one of the things that we see as a challenge is that she's losing weight, which is mentioned in the case study, and she's losing, or she has had a weight loss. So in those cases, the nutritionists and the physiotherapists need to make modifications to her diet to ensure that she's being fed through what is called a PEG tube. So a PEG feed is a feed which is normally put through the nose of the patient, and that PEG feed allows the food directly to be released into the stomach or into the body, and that allows the patient to get the nutrition and the energy that is required primarily to be able to sustain some of the usual body functions. So PEG, I don't know how many of you know PEG, but PEG stands for percutaneous endoscopic gastrotomy. Now, this means it's basically, in short, called a feeding tube. And it's a medical intervention which is normally applied to patients to provide nutrition and keep the patient hydrated, so that in some cases when they're unable to eat or swallow food because they have a condition wherein their food pipe becomes quite narrow, then in those cases they have to look at doing a small incision into the stomach, and this incision then allows the feed to be provided, or food essentially to be provided as feed, which is normally given to the patient to keep the patient nutrition and body mechanism going. So you could consider this as an example and discuss some of the challenges which the medics, practitioners, nurses, and social care workers would have, and that would cover the requirements of the assignment criteria. Is that okay? Any questions on this so far? Any questions? Okay, if there are no questions, let's move on to task 2. Now, task 2 is basically talking about, your line manager is pleased with the information that you've gathered about Mabel and the sheet that you prepared, which basically shows the challenges and the recommendations to overcome challenges. Now, your manager has basically planned to provide further training to include expand this training to covering concepts of equality, diversity, and discrimination. Now, these are 3 key principles that you need to understand for the patient Mabel, because what you are expected to do and understand is that because she will require certain type of treatment, you would be required to understand and implement equality, diversity, and do away with any sort of discriminatory practices while providing care to Mabel during her course of recovery. Now, what you have to do is basically produce a presentation, and these could be about 10 slides that you're looking at making, and these 10 presentation slides would basically be a draft of a material that you're going to try and provide training to some of your other colleagues about what are the concepts of equality, diversity, and discrimination, and the key legislations which you need to be able to take care of when you are providing care to a patient. So this is given as a bit of a scenario or as a task, and what you have to do is produce this PowerPoint material, and it covers these 3 assessment criteria. So first explain the concept of equality, diversity, and discrimination. That means you need to go into the details of what is equality, diversity, and discrimination. And when we talk about this, if you have to refer to it, you go back to our Learning Outcome 2 presentation. And Learning Outcome 2 presentation talks about the Equalities Act, the diversity as a definition, and then the Discrimination Act and the definition of it, to be able to cover these 3 concepts to meet assessment criteria 2.1. So basically you'll have 3 slides, 1 for equality, 1 for diversity, and 1 for discrimination. And you are going to relate it to the context of Mabel, how this would be required, or maybe how this meets the criteria. When you are observing these 3 key aspects, you're ensuring that your care is not being you're not discriminating, you are essentially providing the care and ensuring that she's able to get all the necessary things required to be able to get better. And this would cover this particular part. Now, the second part talks about legislation on equality, diversity, and how it is used to, essentially promote I would say, person-centered approach. Now here we have discussed and we have covered a number of different types of legislations. We have covered the Healthcare Act, we've covered the Care Act of 2014, we've covered the Safeguarding Act, we've covered Data Protection Act, we've covered Mental Health Capacity Act, we've covered the Equalities and Diversity Equality Act of 2010, and in some cases you could use, because it talks about describe, you're not looking at covering all the acts, but here you could cover any 2 or 3 legislations which are required to explain and cover this particular task. So for example, in this case, I would cover the Care Act of 2014, and I might cover the Data Protection Act of 1998 or 2016, updated in 2016 after the GDPR thing was brought in, and that would be good enough to cover this particular task. So refer to presentation of learning outcome 2. The third part talks about describing the sources of information which are available to users of health and social care services. So here what we are looking at is basically talking about what are the various sources that you would be aware of which help you identify if any sort of discrimination is happening or any sort of mistreatment is happening. So sources of information that come and allow you to understand these 3 concepts related to equality, diversity, and discrimination tend to be healthcare providers. We are looking at health and social care providers, which could be providing sources of information. These could be giving you information on and guidance on any specific concerns or queries related to how discrimination can happen, or where do you see equality and diversity not being included or applied fairly, and they would come from organizations which are called health and social care providers. You would also get information from NHS and the healthcare departments. So for example, the NHS and the social care departments would have guidelines, policies, and resources that are available which allow you to address and identify any sources which are creating any sort of discriminatory practice, or are not observing equality and diversity. So leaflets, brochures, flyers, information on the website would be information that you get and use and read to be able to inform yourself about if there is any if some of these are not being applied at your place of work. Now, you could also get into training. Most employers do equality and diversity training. You're also looking at certain advocacy organizations like Age UK, Oxfam, some of the charities which basically provide useful information on how to identify discrimination, how to identify practices in an organization which are considered discriminatory, and these would generally be useful for you because they would allow, if you read that material, they would allow you to essentially understand how to avoid and identify and avoid any such service discriminatory practices which are being implemented within the organization. Then apart from that, the government has a lot of online resources. If you go to the .gov website, all the government policies and literature is available. You sometimes get information from local community centers, your council, government agencies, and ombudsman services, which basically provide information related to Human Rights Act, for example, or you work with charities or individuals which proactively support and provide information about what are your rights and and what action to be taken in case if you feel that there are any disproportionate or discrimination activities taking place. So refer to the handouts which are provided on different acts, and obviously the presentation of learning outcome 2. And you're going to be looking at making 3 slides on this, preferably about 3 or 4 slides on this, because you're picking up 2 or 3 legislations to discuss, and then discuss the sources of information again, 2 to 3 slides, a total of 10 slides with some bullet points and some speaker notes underneath, which explain the covering of this particular task as a PowerPoint presentation. So any questions on this so far? So if you need, you think you need some help and you need to recollect what we've discussed, what I would suggest is refer to Learning Outcome 2 presentation to be able to discuss and develop some of these slides. Now, task 3 typically talks about, again, a bit of a scenario saying that, okay, you've done now the information sheet. After that, you've done the presentation. Now your manager has asked you to, develop further notes on what is PCC, which is person-centered care, and how it can help you develop your career further. So this is a bit of a background given. And with that in mind, what you have to do is discuss and complete some of these tasks. So 3.1 to 3.3. Now, the first task talks about explain the skills and qualities needed to develop relationship with a person such as Mabel and her family. Now, here is where I've given a bit of a hint that you need to use the 6 C's of communication in care that we use. So what you're looking at doing is you're trying to show compassion. You're competent, obviously, you're working as a practitioner, your communication skills are excellent. You have the ability and the courage to be able to see the right things and make the right decisions. You're committed to your work, and the care that you provide is based on the 6 C's, which are prescribed in the person-centered care plan or the approach where when you're dealing with Mabel as a patient. Now, if you use the 6 C's and explain and relate your skills and personal qualities to any of these 6 C's, that will help you cover this particular task. And in places, what you'll need to do is contextualize how would you develop, a relationship with Mabel by understanding the patient and her requirements and who are the key members in her family. And, obviously looking at understanding what is important to her and, what makes her, feel comfortable. This would be looking at taking into account, skills, which are your personal skills, and then implementing them to be able to develop relationship with Mabel so that she can build a relationship of trust with you and she can have confidence on you to be able to, provide the necessary, medication or care which is required for her to overcome the, esophageal dysphagia. Now, the second part talks about how can you as a health and social care worker, promote independence, and allow Mabel to do her tasks independently. Now, if you go back to the slide 1, you see in the scenario which has been given is that Mabel likes to do her tasks on her own. So she wants to be able to live on her own and is, wanting to be able to be as independent as possible. Now, we watched 1 or 2 videos as well during the course of our discussion in Learning Outcome 3, where we talked about Annie. She likes to make a cup of tea in the morning. If you recall that video that I'd shown you, and she wants to be independent. She doesn't want to depend on a care worker or a nurse to be able to make her a cup of tea in the morning, because her normal routine for the last 30 years, when her husband Thomas was there, and when he passed away, she used to make a cup of tea. They used to come and sit together, have a cup of tea, biscuit, and read the newspaper and talk to each other. So she wants to continue with her routine. She doesn't want that to be done by a nurse or a healthcare worker. And that is basically, if you recall that video, wherein the nurse and when they had a meeting, they discussed how they can facilitate Annie making the cup of tea on her own without having any obstructions or any potential hazards like electrocution or other bits, but she should be able to do her activities on her own. So similarly here, what you have to look at is how, as a health and social care worker who would be providing care to Mabel, you look at developing this concept wherein you allow Mabel to become independent or allow her to do some of her activities or daily activities or chores on her own. And that would be done with taking an example. So here, you could hypothetically think of an example like making a cup of tea, going to the toilet, washing her clothes, or maybe cooking her own food, and how you would ensure that, as a health and social care worker, you're promoting the concept of independence and allowing the patient, in this case, to do her activities or her daily chores on her own. So maybe here an example will need to be taken apart from, theoretically or descriptively explaining how you can promote independence. And when we talk about promotion of independence, you would basically talk about independence as one of the key values under person-centered approach, and define independence, and then give an example of how you would, as a healthcare and social care worker, allow Mabel to do some of the tasks which she feels confident to do on her own, and that is thereby providing independence. Now, the other bit that you would want to do is the third task talks about describing situations where health and social care workers can ensure privacy and dignity of patients. So here, when we talk about, do we get this? Yeah, yes. I'll put this across onto the group chat as well. Yeah. So what will happen is in the third task, what you need to be able to do is you need to describe situations where you would be able to make Mabel more comfortable with regards to her privacy and dignity. For example, when she's changing clothes, or when she needs to go to the toilet, or when she's being examined, by the doctor, then obviously pulling in of the curtains around the room, or ensuring that you take consent from her before any treatment or injection or anything, as a treatment is being provided to her. Then in those cases, you're ensuring that privacy and dignity of the individual is maintained. And in that case, as an example, that you would normally say, for example, if she receives a feed through the PEG tube which has been inserted. Sometimes patient become diabetic because of that feed, because it is concentrated proteins which are being delivered directly into the bloodstream. And if an insulin injection has to be given to Mabel, then you would need to ask her that, where do I need to give the injection, or do I need to give it in your stomach, or your arm, or do you want me to give it on your back? And in those cases, you're going to be respecting the privacy by pulling the curtain or asking for her permission. And that is where dignity and respect or privacy is going to be maintained. And using that as an example, that would help you, complete this particular assessment criteria. So in tasks 3.2 and 3.3, you will need to take specific examples of how you're going to be working alongside Mabel as a health and social care worker, and give specific examples. And that's why I've taken an example of, in 3.2, how does she promote independence by, like, for example, Annie makes a cup of tea. So similarly for Mabel, you need to give an example and what you would do hypothetically in that situation, and think of an example to be able to come and discuss that with tasks 3.2 and 3.3. Is that okay? Now, in the extension activity, what we are looking at is the ethical issues which could arise when you are applying, for example, the person-centered care approach, PCA approach, essentially with patients. So here, what we are looking at is, I don't know how many of you recall, but we discussed 4 theories, consequentialism, then deontology, principalism, and virtue of ethics, which are primarily approaches which can be looked into when you are looking at, dealing with ethical issues around person-centered approach. So here in this case, what I would suggest is when you talk about the merit criteria, you have to look at an assessment. So assessment here tends to be giving pros and cons, advantages, disadvantages, or both sides of the coin. And then you have to support the one of your arguments that you're going to support with, providing details. And that would allow you to cover ethical issues. So first of all, let's identify what are ethical issues. Ethical issues could be autonomy, or consent, which is required to be taken. Ethical issues could be related to balancing individual preferences and medical evidence. So, for example, sometimes patients who are vegan but would need certain type of an intake, and that would mean that the intake might not be fully vegan before it's been given as a principal form of treatment to the patient. So in those cases, you'll have ethical issues that although the patient is pure vegetarian or a vegan, but we have to, in order to ensure that proteinaceous diet or proteins are delivered to the human body and tissues, we need to be able to give them a feed which will allow them to have some sort of food which would be nutritious and good for them. So you have to balance the individual preference here, but also look at how medical evidence would support the requirement of giving that particular nutrition. Sometimes you have to look at cultural sensitivity and diversity. So here, a person-centered approach, when we apply that, recognizes and it values the individual differences which could come because of your culture, your religion, your background. And here, healthcare providers must be able to navigate and obviously, put training and development in place, which will allow their staff to understand where people coming from different cultures, what are their requirements, what are the norms they follow, and then ensuring that we are able to respect their background, their norms, and their sensitivity to be able to ensure that the treatment can still be provided, but it is also within the legal requirements of what is being provided to the patients. And then you have lots of other areas. I could look at lots of different types of ethical issues. So, for example, quality of care could become an ethical issue if there is lack of commitment, or the care being provided is not being provided or meeting the guidelines or regulations set by CQC. That could become an issue. Sometimes you will also see professional issues which could come because of the fact that people might not have adequate training, and healthcare providers might have limitation in terms of resources to be able to look at providing for requirements of the patient. And these could be 2 or 3 such ethical issues that you could discuss by providing advantages and disadvantages, and that would allow you to meet this merit criteria. Any questions on this so far? Okay. Now, for distinction, there is one criteria which talks about 2D1. It says provide an assessment of effectiveness of national initiatives in promoting anti-discriminatory practice in health and social care. Now, here, when I talk about national initiatives, what you are looking at is the Department of Health and Social Care, or the government, essentially introducing policy guidelines which will, allow care providers, hospitals, any sort of a setup to be able to pick them up and then implement them within their organization. So one such example would be that when we talk about the legislation of Mental Health Care Act, or we talk about, say, for example, monitoring services, but annual monitoring, which is done by CQC, or inspections and audits, which is carried out by CQC once in 3 years or once in 4 years, they are predominantly done to ensure that the guidance and the acts and policies introduced by the government are being implemented within the setup and the organization. So in those cases, what we are looking at is using the government policies which are required to show what are the national initiatives. So when we talk about national initiatives, here we are looking at initiatives or things which are introduced by the government which will not allow any sort of discrimination to be done when care is being provided to the individual. So discrimination could be done if policies are not implemented. Like, for example, Equality and Diversity Act is not observed within an organization, legal frameworks are not followed, or policies are not implemented, or training and development is not done with the employees. When a new employee starts, they have not been given adequate training on what is equality, what is diversity, things like that. So in this case, what will happen is that you would essentially allow which will essentially allow the government to introduce policies which will primarily then can be implemented within an organization and a setup to allow any such discrimination to happen. Now, monitoring and data control, setting up of quality standards, you're looking at policies and procedures, or sometimes when we see PHE, Public Health England, it does a lot of promotional campaigns or public awareness campaigns to make the public aware of how they should be looking at reporting, for example, any discrimination that they see at their place of work, at the place of care that they are receiving. Then these are campaigns which are being done in the national interest by the government to eradicate any sort of anti-discriminatory policies or practices which are being observed and carried out in any sort of a setup. And they are, I would not say you need to discuss all of them, but discuss maybe 2 or 3 of them, because that would allow you to do the assessment and whether they are effective or not. So here, you might talk about 1 or 2 legislation, you might talk about any of the examples that I've given here, and then talk about the pros and cons of it to complete and provide a narrative which will say whether these are useful or not, and that would help you cover the distinction criteria. Any questions on this so far? Okay, the last task is basically about your own review of person-centered skills. So in the first task of the assignment, we have looked at defining what are person-centered values. Now, what you have to do in task 4 is relate those values to your own personal skills. So here, what we need to be able to do is complete an assessment grid, which is basically given as a brief, as a template in the assignment brief. And this is the grid that I'm referring to, which I've taken out from the assignment brief. And it talks about what you have to do is list down your skills on the left-hand side, like your skills on empathy, your skills on listening, your skills on care, hardworking, whatever you feel are your skills that can be related to any sort of a person-centered value. The 8 values that we talk about: independence, dignity, empathy, respect, privacy, those values that are values associated with person-centered care. If you are able to look at those values and then relate to some of relate those values to some of the skills that you have, and then tabulate them using this particular template. Now, you might say I have excellent listening skills. So if you recall in task 4, where learning outcome 4 presentation, we discussed, active listening, passive listening, which is one of the important skills required for you to become a nurse or become a health and social care worker. So what you have to do is rank your skills as excellent, good, or need improving. And then if this is something that you're not aware of and you feel is a new skill for you, you should tick this, which is saying new to me. Now, in the skill, what I would suggest is you need to explain very briefly in one of these rows. So if you say I have good listening skills, then I would give an example of how do I say I have good listening skills. So you could say that I work as a health and social care worker within the NHS, and I work within this particular area, and in this area I need to be able to listen to patients, their problems, and obviously before I'm able to provide good support to them, it is important for me to listen in terms of what are the issues and what are the problems they are facing, and then I would give them solutions. So a brief summary of maybe in 2-3 lines of why you think your skill is good, excellent, or needs improvement also needs to be done, rather than just a tick box exercise. And that would help you cover task 4.1. Now, there are 2 other tasks in the learning outcome 4. One is the merit criteria and one is distinction criteria. So in the merit criteria, what you're doing is you're using the findings of this sheet, and then you're putting down activities to address how you would go about, improving those skills. So if I say that I have, say, for example, empathy, if I put the skill empathy and I say empathy is a new skill that I have to look at, and empathy is basically the ability to understand and share or understand the feelings of others. So if you say empathy is a new skill, how would you go about developing empathy and this as a skill when you start working within the health and social care sector? So when we talk about empathy, one of the things of empathy could be that, for example, I would look at doing or undertaking some sort of a training, and this could be an employer-led training, which will allow me to understand the meaning and use of the word empathy and how I could show empathy while dealing with my patients when I provide them daily care, or when I'm working in shifts to be able to provide care. And that would be an activity that you would be taking. What is an activity? You're going to get into a training, employer-led training, and that would allow you to develop the ability to understand other people and understand wide range, using your wide range of experiences, understand how you can relate to other people's problems, show relevant emotions. And this would allow you to understand somebody's feelings and thinking, and then tailor your care plan to ensure that you are being empathetic to that person when delivering care using person-centered approach. So here you have to look at maybe 2 or 3, I would say, bullet points or small paragraphs that you will basically look at, highlighting that why do I need to improve these skills by undertaking these activities. They will come across if it says needs improving. So if any of your skills that you put here, like I don't understand privacy, or you would say dignity, for example, and here then you would need to undertake some activities because you need to improve them, would come across in the merit criteria. In the distinction criteria, what you have to do is develop it into what is called a PDP, or a personal development plan. Now, personal development plan would be a plan which will be an ongoing plan which has a number of activities in it. And this plan essentially allows you to understand what are the activities. It will basically list out the activities that you're going to undertake to be able to improve some of your person-centered skills. So there is a PDP plan template which I have provided upon Moodle that could be used to create a PDP plan. And it could be, this is a working document. What is a personal development plan? It's a working document which you keep making, keep updating, keep reviewing. And this document, you keep writing the activities which are going to be in your weakness areas, and what are the activities that you're going to take or undertake to be able to remove that weakness. So in some cases, if I say as a person-centered approach, if I use that and I say, okay, I do not understand how to help people do their tasks independently, how to respect independence when they are looking at doing tasks independently. So here, one of the activities that you will undertake would be that you will put it down on your side to say that I would need to look at undertaking training, and that training would be to understand the person-centered value of independence and how independence can be promoted with patients in terms of when they are taking decisions, by providing them information, by looking at observing and understanding their preferences and their needs, and then tailoring my support to be able to give them information which allows them to make decisions independently. And that would be a plan that you would put as a small bit of activity in your personal development plan. So refer to the template which I have provided, upon Moodle. And if I refer to that particular template that I've provided upon Moodle, that would allow you to download that template, and then you would be able to use that template to make a personal development plan. Now, we don't want an extensive plan of 5, 6, 7 pages. One odd page would be good enough for you to be able to, put down a few activities that you think are necessary and important and required, and they would be generally okay for you to complete this particular distinction task. Now, if I just very briefly switch you over and put you on to show you the screen of Moodle. And what I want to do is basically, when I show you the screen of Moodle, why I want to do that is I want to make sure that you are able to see. Now, this is the assignment brief, which we have to look at attempting. So if I quickly mention and, show this here, this is the assignment brief that we are discussing. Now, for some of the tasks that you will see, these are the templates that I provided. Say, for example, you want to look at developing a personal development plan. That's the template that you would need to use. Person-centered values are here that you're using. And then this is related to your skills audit. And these are initially the person-centered values that are given in task 1.1. Now, all the bits are available to you on Moodle. In some places, you would need to download these Word documents so that you are able to use them to complete these documents, and they would then provide the evidence required, for this particular unit. So use these documents judiciously to cover some of the tasks, because they would be useful for you rather than to reinvent anything. It will be, useful for you to use them to be able to compile and then submit and use them in your document. So you could click on, say, for example, the PDB template, and that would allow you to essentially use that format and then include in your document as far as assignment is concerned. So I hope this bit is now clear. And one of the other things which I would quickly mention, if I switch you over to the presentation of the discussion that we are doing for 1 minute, would be to look at then making sure that you're properly formatting your assignment, making sure you're writing a bit of introduction. If you're using Mabel as a scenario, if you're using your own personal place of work or your own place of work as to include as examples, then put that in a bit of an introduction, and then make sure that you're writing the tasks very clearly. and then ensuring that you're answering those tasks to be able to, attempt and get the grade that you're trying to achieve in the assignment. Now, when you look at submitting your assignment, please make sure that you submit your assignment. Don't look at this. This is an old date. So when you look at submitting your assignments, please ensure that you're submitting your assignment within the next 2 weeks. I would say by 15th of June. Make sure that you're referencing your work. If you're using any sort of references from the presentation, then please refer them accordingly and reference them so that it shows that you're providing credit to the author, in this case me, who has created these presentations while you're using them in your assignment for the purposes of submission. Now, if you have any questions, any queries, my suggestion would be I'm going to share a copy of this presentation, pretty much straight away in the group so that you're able to, essentially, use it for the purposes of assignment discussion. What I'm going to do is make a small change into the assignment discussion date and the work to be submitted to learner work at UK Versity. I'll make that change and then put this presentation on into the group so that you're able to have it. And then by all means, access Moodle to be able to download some of the documents, which will be useful for you to, use for the purposes of your assignment discussion. So I hope you found this session to be useful in terms of how you're going to look at discussing and compiling the evidence for your, assignment. And I look forward to receiving them to be able to mark them. Make sure that you mention the grade that you're trying to achieve in the assignment on the email so that we can give you feedback commensurate to the grade that you're trying to achieve. And the submission date should be 15th of June, 2 weeks from now, so that we are able to conclude, this unit and move to the next one. Any questions at this stage, anyone?
Yeah, hello.
Go on.
Sorry, I don't have the access like these slides, like the presentation that were in the module. I don't have access to them in the module. So can you just drop them for me, please, in the group?
So in the Moodle, Toby, you should be able to see definitely these slides. Normally on the Moodle, you would see them as, so let me just quickly do one thing. Let me just show this right now. So as you can see, this is this you on Moodle?
Yeah, that's me on Moodle.
So you have never accessed Moodle for some reason. So if you haven't accessed Moodle, you wouldn't be able to get it. So if I just go back now onto the Diploma in Health and Social Care, this is person-centered approach. When you click on this, this opens the full unit up. Anything that I've provided in the session, anything that I've discussed is all given here. Now, if you haven't been able to log into Moodle, all you will do is basically go into Moodle here. You say, forgot your username and password, put your email address here, and then click search. So if you put your email address here and click search, it will send you a temporary password to be able to log into Moodle straight away. Then follow that link. It will bring you back into the course. And when you're back into the course, you should be able to see everything that is currently, available for you to access and what I've discussed. So they are normally shown as headings, but that does not mean the material is not there. As you can see, there are 39 documents. When you click on the heading, it will take you into the course and you should be able to access this pretty much straight away.
All right, thank you.
Okay, no worries. Any other questions, anybody? So a copy of this presentation, I'm going to make available just after the session. I'll cut and paste and put this across onto, the Moodle in a minute. But you can also access these sessions if you go on to the YouTube channel. As you can see, if you go on to the YouTube channel, under the live section, this session is currently being broadcasted live. So when I click on live or after the session is concluded, you'll be able to see this session fully recorded from start to finish, and you should be able to get or revisit this session if you need to do so. So if I click on this, it will show a bit of an echo, but that's why I don't want to. So this session is available under the live, and this will be clearly labeled as person-centered approach assignment discussion session. Okay. Good stuff. So thank you so much for attending, and I look forward to receiving your assignments We'll be sending out a new schedule, for the next unit for those of you who are going to study the next unit with us, and they will be going out later today. So timings will remain the same, Monday and Tuesday, 11 a.m. And hopefully I will catch up with you for the next unit. Thank you so much for attending.
Sorry, Raman, that means
Yeah.
tomorrow we're not in.
Sorry,
That means tomorrow we are not in.
in what?
Sorry, on Zoom.
No, we will be looking at a new unit. So person-centered approach as a unit has been completed. For those of you who are looking at the next unit, you will be basically looking at joining the session with a new lecturer, maybe new unit and a new lecturer. And that will be sent across to you